Welcome our presenters, filmmakers Terry Sternberg and Laurie Simons, to be with us. I first met Laurie and Terry when they gave an excellent workshop at a Unitarian Universalist Social Justice conference in the Pacific Northwest District. And they introduced their first film, the healthcare movie. And in it, they helped us see that if Canada could do this and go from independent, private, individual insurance to universal health care for all nationally, then the United States could do it too. Then several months ago, I was happy to see a notice that their second movie, Now is the Time, would be shown at the Meaningful Movies series, which hopefully others of you have, at Northlake UU congregation in Kirkland, Washington. So it is very timely that healthcare is at the top of our agenda for justice workers and politicians alike. The movie is informative, clear, personal, persuasive, and even humorous at times. I've been recommending it to anybody who will listen to me, including to legislators. I came away, and I've seen it 3 times now. That's how enthusiastic I am about it. I came away believing that resources like these films are what we need to educate and persuade, convince our United States citizens that universal health care is the best option and that we can get there from here. Terry and Laurie moved 2 years ago from Washington State, where I live, to Staten Island, New York. And they've traveled the country in between promoting their first movie, so they know our country well, coast to coast. Their skill at filmmaking is masterful. Their dedication to healthcare justice is inspiring. They will tell us about their journey to promote healthcare for all and how they came about producing this movie, both movies, and fill us in on what is happening with that movement now and ways that we can participate. So Terry and Susan, welcome, and please tell us about your journey to make these great movies. How are they being used? And what is happening now that we can all work on? Please.
So we have a show who has seen the movie Now is the Time, from people who are in the, like,
yeah.
So some of you have not?
Some there. Yeah.
Okay.
Well, a lot of people haven't. Good.
So I'll start by talking about.
That's it.
That's
there
done.
it is.
Yeah. Thank you. The first movie that we made was called The Healthcare Movie. That was released in 2011. We made that movie, we started making it in 2009, and there's a little story to that. It starts out with me being raised in Canada. I grew up in Canada and experienced the Canadian healthcare system. Terry is American. He came up and we got married in 1982, and he spent 10 years in Canada, and we had 2 sons born there in a hospital in Calgary, Alberta. And then in 1992, we moved with our sons, who were at the time 6 and 9, down to Seattle area. And in 1992, that was a time when Hillary Clinton was supposedly going to transform the healthcare system of the United States. And we were very happy to hear that, because for me, even though I had known what it was like in the US, conceptually, I didn't realize until I got down here how different it was, and how when our son fell on his rollerblades and hurt his elbow and needed stitches, we had to consider whether we could afford to get him treated, and that was pretty devastating. And I was Canadian. I didn't really have much of a voice. That's what I thought at the time. Fast forward back up to 2009, and in that time period, Terry and I both started out as counselors, and so we've been counselors all along. And so somewhere around 2002, I went to college to get some training in video and TV production. And in 2009, when the Affordable Care Act was being debated, we were hearing some things that we had heard in 1992 from people saying things about Canada, saying things like, oh, you don't want that kind of system. You have to wait, you die waiting, and it's socialist. And nobody would ever have any further conversation than that. So we were joking around one day, and Terry said to
Thanksgiving
some
dinner.
friends at Thanksgiving.
It was a Thanksgiving dinner, yeah.
In 2009, somebody should make a film about the Canadian healthcare system for Americans so that they really know what it's really like. And our friends at the dinner said, why don't you guys do it? So we did. We made a film which was about what happened in Canada that led to them having a system that they have. We discovered a lot of things along the way of making that film. One was that in about 1950, around the time when we were born, the healthcare system in Canada and the U.S. was almost identical. They had the same kinds of doctor-sponsored plans people paid into. If you paid into a plan, your doctors would see you, and if you played in the hospital plan, the hospitals would serve you. And then things took a very different turn when Canada went for its national plan. And the other thing we discovered was what was happening in the U.S. concurrently, which would have been between 1948 and 1962, was that there was a big campaign against having a national healthcare system in the U.S. that was paid for at the time by the Medical Association of America. They didn't want a nationalized plan. They thought it would it would tell them how much they could charge, and it would tell them how to operate medicine. And so because of that fear, they paid PR experts to send messages all over the United States about, we don't want socialized medicine, we don't want the government to take over our healthcare. And the same messages that were put forth in 1948 came back in 1961 with Ronald Reagan giving his talk to people about, you don't want that kind of a healthcare system, came back in 1992 and 3 when Hillary Clinton was trying to do it. And in 2009, word for word for word, we were hearing exactly the same phrases over and over again. It was pretty mind-boggling to us to realize that this campaign had really led to such a complete difference in the two systems. In Canada, they got some of that messaging, but they were able to step past it because they weren't afraid of socialized things at the time, and they tended to be more cooperative, especially in the province of Saskatchewan where it started. So the first film was all about what happened. It wasn't a bird walk in Canada to get healthcare. They went through a lot of rough times trying to get it through, and the movie goes into that. And it kind of concludes with the point that, the reason Canadians have it and Americans don't is because the Canadians voted it in. So that film we took that on tour, and we started it around, I guess, January of 2012. It was just released the previous summer. We showed it up in Canada, and they really liked it there. And then we did a tour of the East Coast and a tour of the West Coast with it. And it's made it around to various conferences on the subject of healthcare. And many advocates around the United States have used that film in their advocacy work. So I'm going to let Terry tell you about the next film.
Okay. The Now's the Time film movie was a pretty quick movie. We wanted to get this movie out. We decided.
It was on your birthday.
It was on my birthday, yeah.
It
was in 2015, wasn't it?
Yeah.
Yeah. No, 2015 on my birthday in December.
Yeah.
And we wanted to get this film out in time for the elections, and that's really fast for a movie. That's like, what, 8 months, 9 months, 7. And so we did it really, really, really quickly. It was kind of a rush job. And then we showed it in Colorado. and because they want, to influence the referendum in Colorado, and we all know what happened there. I don't need
maybe people don't know.
Do we know what happened in Colorado? How it was so badly defeated. The referendum was badly defeated in Colorado. For me, making this movie, we weren't going to make another movie on healthcare after the healthcare movie. But it became more and more aggravating, I guess, to keep hearing the same phrases again, even after 2011 and then the ACA was passed. We kept hearing things that about the Canadian system, but also even about the ACA that just weren't true. People, there was just a lot of myths that people were repeating. A lot of lies. I would say that there were lies, whether they were intentional or not, is I suppose we could debate. But things that just weren't true about, and things that people thought. For instance, some people thought that the ACA was a single-payer system, that it was universal, which we know it is not. There's still 28 million people that aren't covered through the ACA. But these things really became very puzzling to me, and because when people really look at the benefits of a single payer, Medicare for all single payer system, to me it just seems like a no-brainer. I mean, it's like there's so much benefit from that system that all of the problems that we hear talking about in terms of the ACA would be solved with a single payer system. And so for me, it was like I had to do this other movie to find out why this was not being discussed. Well, single payer and universal health care was not being discussed in our Congress. And so that was, for me personally, that was one of the primary motivations, was really to discover why, what was behind all that. And that's described in the movie as well.
You're not going to give him a hint?
Well, I think we all know, along came Citizens United and gerrymandering, and there's a lot of reasons why. But those are two primary reasons that single payer is not being talked about. Big money, primarily, I think, is the primary reason. But so we want to move to questions, don't we? I mean, are there things that you want us to talk about?
The movement, what's happening now?
Yeah, what's happening now?
You can talk about where we've taken Now Is the Time.
We've taken it.
Yeah.
We really go where people want to see the movie, and we toured in California. We did a 20-city tour on the West Coast, 22-city tour on the West Coast. We have a lot of friends in California now, but they're very strongly supporting Now's the Time there. But also
Ohio.
And we went to Ohio and we Baltimore, Washington D.C., Philly. So we go where we're asked primarily. We don't plan these ourselves very often, but every now and then we do. We're going to Maine in a few weeks because they're doing they invited us to come up, and we're going to be there. So what would you like to know?
Harry, it seems as though Lucy has dropped off. I can't hear her anymore, so she might have had a technical problem. Before I open it up to everybody else, maybe one question from me. When you go around, and I know you speak up very often after the film, what is the major surprise people have, or after seeing the film? What do people mostly? What do they learn? What do they think is the biggest surprise after they have seen your film?
A lot of people tell us that they finally understand what single payer means and what it is, and how it works economically.
Yeah, we really covered the basics in this movie. So if people don't understand single payer, hopefully this will help them. We also show when I'm not sure if there's a name for the group that went to Margaret Flowers and Katie Robbins and so forth went to
the Baucus hearings.
The Baucus hearings, that's what it was. We
in
showed
2009.
some pieces from that, and people are surprised at what happened there because either they've forgotten or have never seen it because it was on CSPN.
Yeah, but what people don't know is how much the issue of single payer was brushed aside, not just brushed aside and ignored, but literally people were arrested for bringing it up during these talks. And so those are some of the scenes in the movie. It's very dramatic what actually happened.
Right.
And to find out who actually wrote the Affordable Care Act was the insurance company people. And so some of those things are also surprising to people.
Yeah. The other thing I think that I don't know about surprising, but people have said they really appreciate it, is Gerald Friedman is in the movie, and he goes over what really needs to happen in terms of a campaign, that we really need to be straight with people about telling them that taxes are really a major part of this and that the taxes will go up, but ultimately, and we show this in the movie, how that the taxes going up and what we'll be paying in taxes for a single payer system is still less than what we're paying right now through our insurance companies. And that people appreciate that as well.
And Gerald Friedman is an economist, by the way, who has done a number of studies to analyze how Medicare for All system would work at the state level in a number of states and also at the national level. And he's pretty much shows that it not only would it save money, it would save a lot of money and at the same time cover everybody. So another thing that people see in the movie that gives them a sort of a chuckle, but is not funny, and that is that realizing that the government really is not representing us. The government is representing the big investors who have a say in how in which laws are passed, and that even if people really, really want something to happen, that's not what's happening at the federal level. And so it basically concludes again with how we need to not only say how we think it should go, but we need to get together with everybody else and say it all at once, even with people who are favoring other kinds of issues.
Okay, thank you. I'd like to open it up to questions from anybody in the group. You have on the lower right-hand corner a little button, which if you tap will put up your hand, and I can know if you want to ask a question or not, and I will unmute you when I see that. So if you have a question, just tap that lower hand that in the lower right-hand corner, and I will unmute you.
So just to
we
say,
have,
we don't have that on ours. I don't know what ours looks like. Is you have to go down below where it says participants and open.
Okay, so there might be two ways of doing it. Okay, I have a question from Marguerite. You're unmuted now, Marguerite. Marguerite, you might have to unmute yourself.
Hey,
Keep saying.
There we go. Oh.
There.
Let's see.
Now you're unmuted. Okay.
Okay. All right.
Yeah,
Hi.
I guess just because nobody else was asking anything, I thought I would ask, of course, what you think of the difference between Bernie Sanders' plan that just came out and the one that's in Congress, the HR 676. So there's quite a few differences. What do you think has a better chance? You know, that sort of thing.
Well, do we both want to say? Okay.
Go ahead.
Well, first of all, when I've been expecting, well, we all have expected Bernie Sanders to do his bill for months. You know, he's been saying he's going to do this. So I was almost prepared to be disappointed. And quite frankly, I'm not disappointed in his bill at all. I think it really, if it passes like it's presented, will be a big boost. Okay. And the other thing about Bernie Sanders that I want to say is that, of course, right now we have more support in Congress, the House and the Senate, than any time in history. And the fact that there's 16 senators that are ready to speak for single payer is a huge, huge, huge thing. And so it doesn't mean it's going to pass. It's just the fact it's never been that way before. So this is a real transition. I think, ultimately they're going to have to come together on the two bills because they can't each pass their own bill. So, I like them both. It's pretty hard to, it's pretty hard to pick one. You want to say something about that?
I just want to say that I think it's quite remarkable that the Congress bill, HR 676, which John Conyers has been introducing since 2003, every Congress, over and over and over again, has grown in support in January of this year from 59 endorsers to 116 endorsers. And that's like more than double what it was. And so to me, that's exponential growth. And I'm very optimistic, whereas I haven't been for years. I'm now starting to be very optimistic.
Yeah, I guess I know one. Is it okay for me to talk?
Yeah.
Yeah.
Please.
Oh, yeah. Of course.
I know one difference. I read them quickly, so I'm not sure what was, though, that there will be some co-pays for certain medications and things, which of course a lot of the single payer advocates are not for. But I wonder if that might be one way to just sneak it in to people who just, can't, just are too afraid to say everything's free, it'll be abused, all those things that people always say that apparently hasn't been proven in Canada. Is that right?
Right.
Right, and Canada did not include pharmaceuticals in its original healthcare plan. And so they also didn't include dentistry, and they've been kicking themselves around the block ever since. But at the time when they passed it, they thought, well, we'll just add those in later, and it's just not easy to do. It's not easy to add things in later. And so it is a bit of a compromise to have copays on medication, but the Canadian system didn't have pharmaceuticals at all. So it's actually an improvement there, and it's probably going to be a hard thing to get rid of. But I think, to at least include it in the plan is a better step.
The other thing that is a major part that has been left out of the Sanders bill is that he doesn't really describe where the money's going to come to pay for this bill. And that's the big issue all over the country. It's what's stopping it in California. It's everywhere. My feeling is that when people bring up that issue, it's a really red herring in some ways, because, I can't believe really that the people in the United States of America cannot figure out a way to finance single payer when there's so many places in the world that have figured that out. It goes against my grain. The other thing is that there's been a number of plans that have been laid out and very specifically laid out about how to pay for it. There's a number of ways to do it. What Sanders' bill didn't do was choose one, or it's in another paper, I guess, is what I've read recently. He's going to lay out a number of different options of how it might be paid for, but it's not part of the bill, and that could present a problem. It kind of opens the door for the conservative point of view to just kind of jump in there and make a mess.
We have another question from Door County. So I'll unmute the folks from Door County. Go ahead, please.
So you just can stand up there and ask your question. Okay. When I watched your film, I had a reaction to the 11.5% on payroll taxes, because I think that the average citizen is going to have a lot of trouble with that number. And you compared it to what people are already paying in their insurance premiums and co-pays and so on, that the total of those things would be higher than the 11.5%. But I think that's going to be hard for people to grasp, and that many people are not going to sit down and figure that out and say, oh yes, it's true. It would be more. And then there's also the issue of those who are not employed. Those people who are not employed would still be covered. And so your average citizen is going to say, but then I'm paying for all these other people. I just feel that that's going to be an issue.
Mm-hmm. Mm-hmm.
Yeah. And it is probably one of the main issues that, as Terry says, will be used to dissuade people from wanting this, because they'll be saying, yeah, well, your taxes are going up. And one of the other things that I think comes out in that the Now is the Time movie is that we're already paying for the people who are unemployed or on Medicaid, on Medicare, on veterans payments, and we're also in our taxes we're already paying the subsidies for the people who are on the Affordable Care Act plans. And so there's a lot of education we need to do to get people to continue the conversation after some of these conversation stoppers come in. It used to be socialism, used to be wait times, and now it's going to be taxes. It's going to be a conversation stopper. We have to find a way to keep the conversation going. And people don't trust the government, obviously. There's lots of good reasons why. And so why would we want to give our money to the government? But then the question is, well, would you rather give your money to an insurance company that's out to make a profit off of your illness? It's right. Not a good choice either way.
Yeah. I think you bring up a really good point in that people are more likely to respond on an emotional level to my taxes are going up, rather than the idea that it's going to be going up less, because they don't know that for sure, right? I mean, you can figure it out, but it's still something we're figuring out. They know what they're paying is right now, and if we say, well, we're going to pay 11.5% more, it doesn't look like it's payable unless this is a real important education point. It may be the most important education point I think that needs to be done in terms of single payer is how each person is going to be paying less for this.
It's so unbelievable coming from Canada. We have this, Terry and I have this sort of analogy we use, that when you are in the United States and you're thinking all the time, and I'm on Medicare now and I have bills every day coming in, more bills, and my supplemental insurance is going up, and I'm always thinking about the money and should I continue, getting my medical care that I need because it's going to cost me. We have this jackhammer going on all the time when we live in the U.S. about the cost. It's a jackhammer. It goes on all the time. You don't even know it's going on unless you've actually lived in a place like Canada where it's like birds singing. There is no bill for anything, nothing. You never think about it. It doesn't even cross your mind. That's the piece that's so hard to portray, and that's why I wanted to make the films, to try and portray that if you could imagine that peace of mind, you would pay so much more in taxes to achieve that. That's just my opinion.
We have a text question from Richard Eng about Gerald Friedman. He just looked him up in the Wikipedia, and the review there isn't that positive. And apparently, he's also been criticized by Paul Krugman, the Nobel laureate in economics.
Yeah.
Could you comment more on that criticism of Gerald Friedman?
Well, what's the criticism exactly? Do you know?
In the text, he doesn't mention it.
All right, that's all right. Go ahead. You want to say?
We talked to Gerald Friedman about this because we were
yeah.
there interviewing him right at the time that Forbes magazine was writing articles about him, because he was invited to do the financial analysis for the healthcare plan that Bernie Sanders was putting forth during the primaries and so on. And so it was interesting. It would be good if we knew more of specifically what the criticism was. So if whoever's asking the question could maybe send that to you. We could
Well,
address it more directly.
I mean, he's been
But-
criticized in several articles that I think one person said it that single payer was like, and this may have been Krugman, that said it's like sugar and roses or something, like it's completely imaginary, that it could never work and type of thing. The interesting thing about Krugman is that he was actually for single payer before this, and he switched over after the ACA, and it's just interesting to me how maybe he became more enlightened. I don't know, but I think that's an interesting thing to note. And in fact, we even have a video of him saying that single payer is by far the most efficient way to finance healthcare. And so, it's interesting. I don't. It's hard to know. People change their mind, I guess, in different.
I do have, Paul thinks that Gerald's analysis are very out of touch with reality.
Right.
It's not just Paul, it's many other economists in the Wikipedia article. Huh?
Mm-hmm. Yeah, I don't know what to say about that.
Yeah, out of touch with the reality of the insurance industry paying off all of the people who are trying to support the Affordable Care Act.
Yeah.
But the truth be told, it isn't as simple as you would think. It's certainly not like what happened in Canada to have a system like that in the U.S. Because in Canada, the insurance industry did not come in and take over the healthcare system. It didn't happen at all. And so they didn't have that piece to overcome. And so I think some of the arguments I've heard are that Gerald Friedman is talking about the money that would be saved. Well, in order to save that money, you have to get rid of the insurance companies and all of their overhead. And that isn't simple.
Right.
That may be where the criticism comes from.
Right.
Can I jump in?
Yes. Yeah.
Phil or Lucy, go ahead.
No, I went with a delegation a week and a half ago to Susan Delbene's office. She's a U.S. representative, and she's spoken at several town meetings and so forth. Their concern, the intern talking to us, concern that she expresses is that people will not want to give up their current policy, whatever that is. And that they were particularly mentioning insurance policies rather than just the physician. We understand people may not want to give up their physician, but it was interesting that they were actually saying they don't want to give up this policy that they have, and that's why she, and I think it's true of our senators too, or mainstream, the Washington senators, are afraid of change. They're afraid that people will not allow for any change. And that is a human characteristic, that your first response to change is what's it going to cost me, or what's wrong with it. So I just wondered if you could comment on that. We do need to influence our senators and our representatives, and if they're using that as an excuse, how can we meet that?
Well, I wonder what evidence they would have that would be true. For one, that's the first thing that comes to mind, is that people will want to keep their policies. I would get my guess about if there are those. I mean, I'm sure there are those people. I'm not sure that they can afford it. I mean, these are people that obviously can afford the policies they have. There are many people that isn't even an option for, whether they can keep the policies they have, because they can't afford either insurance or they can't afford the policy. I can certainly understand the argument that people will be resistant to give up their present known policy, because what you're asking them is to enter the unknown and trust. The whole issue of trust comes in at some point, and like Laurie says, if you're trusting the government, that's a huge leap for a lot of people. I mean, it's very difficult.
We have 2 or 3 other questions here, so I'm going to try to move it on to them. I'm going to, Phil, I'm going to unmute you if you want to ask a question.
Great, thank you so much. Can you all hear me?
Yes.
Yeah.
Great. Well, thank you so much for the presentation. I really appreciate it. So my question relates to some of the things that some of the other speakers have touched upon who are asking questions, which really relates to the way in which the move to single-payer healthcare touches upon some issues that are politically very sensitive, like, for example, taxes and things like that, which automatically for a lot of people set off a lot of red alarms and cause a lot of concern for people. But one thing that I feel like you see time and time again from kind of more conservative circles is very clever efforts to brand something as being different than it is in a way, but at the same time, it also is pretty effective at, like, people maybe agree and sometimes with the concept, but it moves people beyond that kind of initial red alarm that goes off if they hear the word taxes. What kind of comes to mind is, like, for example, right to work legislation isn't actually about giving you more ability to have workplace protections, but it's a very clever kind of branding opportunity. So what I'm wondering is, given that I think there seems like there's a lot of kind of conceptual agreement that amongst people that a move to a single payer would be a positive step and a lot of people would benefit from it. Are there any kind of efforts to kind of, in terms of branding, to kind of reframe this discussion in a way that gets people kind of beyond those, for example, just like a non-starter like taxes, but kind of reframing it in a way that kind of appeals to the way in which it actually does benefit people and it really conceptually appeals a little bit more too?
You know, that's been an interesting conversation over many, many years in the community of healthcare advocates. You know, well, what do we call it? Should we call it single payer? No, that's not good. We should call it Medicare for all. No, we can't call it that because Medicare is not that great. And so it's been it's been one of our issues all along with the whole advocacy community is, like, you know, pick something and move with it. And they even talked about hiring somebody to do some wordsmithing, which is what all of the insurance companies literally use our premiums to do. They use our premiums to hire people to wordsmith so that the insurance company is called at your side. And, you know, like, they have all these really cozy phrases they use. And I think Bernie Sanders has coined the term Medicare for all single payer, Medicare for all single payer, Medicare for all single payer. That, I think, is the one that's becoming the most commonly heard. And the Medicare for all with the single payer attached, I don't know that people know what single payer is, but they know that it's not the same as Medicare. So there's something, so I don't know if there's anything better than that out there
I agree
right
with you.
now.
Yeah.
Okay, we have another question from JF Tordella. I'm going to unmute you if you'd like to ask a question.
Hi.
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 Thanks very much. And this is a very interesting discussion. My mother talked about single payer most of my life.
From Blaine, and I'd like to be able to talk.
Oh, we have two people at once.
Somebody's talking over me.
Yeah, whoever's on, we will get to you. We're trying to just do one question at a time. I've got another question by Pablo, and then I'll ask you to ask your question. So we've got a little bit of a line for questions, if you don't mind, okay?
Yep.
Okay, thanks. Sorry, you've got a mother who talked about single payer?
Yep, the whole time I was a kid. The other comment that I have is that when I went on Medicare, I got the absolute most coverage I could get. And as a result, I don't get any bills.
Aha.
Right.
Yeah.
I have that too.
But you're paying.
But you have to pick Plan F and you have to know about Plan F.
Yeah, I took a high deductible Plan F. That was a problem.
That was a difficult, that was not smart.
So, well, you just have to know, and somebody has to help you understand that.
It's very complicated. I have a master's degree and I still don't understand it.
Yeah, that's what you need.
Those are my only comments for now.
Thank you.
Thank
yeah,
you.
I
Thank
totally
you.
agree.
Thank you.
Yeah.
Pablo, here you go.
Okay. Okay. My question goes in a slightly different direction. I'm wondering if in the research and preparation for your film, if you came across other examples of professionalized lobbying efforts having changed the alchemy on a public policy issue. So, dramatically. And I'll just share with you that there's at least two that I'm aware of, and I'm wondering if they came up in your research. One is at the inception of the AMA, when the mostly male profession of doctors wanted to sort of push midwives out of the central role of healthcare. A lot of the language that they used was designed to instill fear among service recipients about the competency of women as central healthcare providers. That's the first one. That's the famous one that I know from my public policy background. The second one is the fat-free movement, which is, from what I understand, the brainchild of the sugar lobby. About half a decade ago, there was a lot of emerging research among nutritionists and health scientists that sugar, fat, and salt were leading to all sorts of deleterious effects in the human body, and the sugar lobby poured tons and tons of money into coming up with some phrasing and phraseology to steer people's attention away from sugar as a culprit. They bought themselves at least, I think, 3 decades. And then the obvious one, of course, is tobacco. Mm-hmm. Any other examples that you guys came across in your research and travels, since you're talking about such an interesting topic?
We've seen quite a few, I think, since we made that film. But the couple, Whitaker and Baxter, Clem Whitaker and Leon Baxter, the couple that was hired by the American Medical Association in 1948, had many, many other projects on even different subjects that were very, very successful. And we also came across, what's the name of the Republican, Frank Luntz?
Oh, yeah.
The Republican consultant who talks about wordsmithing, who came up with the government takeover phrase.
Yeah.
So we were kind of mostly sticking in the healthcare realms, but that's definitely the fact that they're using our premiums that we pay to the healthcare industry to pay for that kind of wordsmithing was very problematic to me.
I mean, wording is very, very powerful, and there's some examples of there's positive examples as well. Two of them that come to mind. The first one is like secondhand smoke. This is a phrase that didn't even exist
until it did.
It was just, and it's been very, very powerful. And the other one that is designated driver, in terms of finding somebody to drive home. So wordsmithing is so important in this whole process. It's really very important.
Okay, we've got a couple other more questions. If you want, I'll get to you in a second. If you'd like to ask a question, you can go to the lower right-hand corner of your screen and click on the raised hand, or you go to participants and click next to your name. There'll be a raise your hand symbol there. I think I'm going to it's the 360 area code, huh?
Yeah.
Thank you. I'm Donna Starr, and I'm president of United for National Healthcare, and hallelujah, we've been waiting for this for a long time.
Yes.
I like this conversation. There was something that we've decided to do, and that is take the word jobs and taxes out of the conversation and instead talk about, I think the wordsmithing idea is a really good one. For instance, questions like, why should insurance premiums pay for vested dividends, or pay for lawyers that we have to fight against denied services, or huge CEO salaries, or actuarialists whose jobs it is to find out who's worthy and safe as insurance bets, because we're dealing with a for-profit system. I think talking like that is going to be very helpful because people have target words that they're afraid of. Today in the Billingham Herald was an article about the president wanting to cut taxes for corporations because they weren't competitive. Well, the idea is that their insurance costs are about 15%, and if you would cut insurance costs 15%, then you wouldn't have to cut their taxes. I think that these might be conversations that people might be more willing to listen to.
Mm-hmm.
Yeah,
that's great.
Exactly.
Yeah.
Okay. One comment on positioning, and I just want to remind folks you can just press on that button to get a call. But I had a conversation last week with our local assemblywoman, and I think she said something very interesting about wording and positioning. She said we've got to be careful that our goal is health care for all or guaranteed health care, and single payer is the best method to get there. But it's not the only method. There might be, a lot of national systems have multiple payers and yet have full healthcare coverage. So I'd love your feedback on that, Lori or Terry, also. Huh?
Well, there's a major difference in those countries, like Germany, for instance, that has this, and T.R. Reid talks about this in his book, Healing of America. The thing that is hugely different in those countries is that those insurance companies are very highly regulated.
Right.
They have caps on what they can charge, which isn't the case in this country. And so, if that were the case in this country, if we weren't afraid to regulate, it would make a difference.
Right. Yeah, and often they're non-profit. Huh?
They're also nonprofit. Yeah, the same is true for pharmaceuticals.
Right. Well, last call. Any other questions for Terry and Lori? We're running at the end of our hour. If there are any other questions.
If not, there's one more comment I wanted to make about, I think, what Lucy was asking about the insurance policies. That when people say, I like the policy I have, I think they're going to notice that the policy they have has higher premiums that are going up. The networks are getting narrower. The cost sharing is increasing. Pretty much everybody is noticing all of that. And with the other thing is that people expect their insurance to be employer-based. And so sometimes when people's employers are paying for their insurance, they don't even see it. It just kind of comes out of their paycheck and they don't really think about it. And so they like what they have because it seems like everything is covered. But the insurance premiums are really becoming less and less affordable and more narrow. That's going to start hitting everybody very soon.
And cover a lot less than single payer. Single payer would cover everything.
Yeah.
Good. Any other questions, Michael?
I have no. Rachel has a question, so let's go to Rachel.
Hi. Just one before we close this about next steps. We have healthcare bills now introduced. We have co-sponsors. What is it you think we should do in our communities, in our state houses, that would make the most impact for the movement for healthcare?
Well, we're a little biased, but here's what we think. We think that people need to be educated, and we think movies are a good way to do that. So what we would suggest is that if you can watch the movies, if you haven't already, download them, order DVDs, show them to your friends and families, show them in your congregations, host public screenings at your libraries, your community centers, your local theaters and union halls, and we can help you do that. And if you visit our website, nowistheTimemovie.com, you'll find under Watch Order, you'll find the movie Now Is the Time. You'll find a short version of the movie Now Is the Time, which is 35 minutes instead of the feature 70 minutes. And that's for if you have a short meeting and want a discussion. You'll find the healthcare movie download or pay-per-view, and you'll find a screening kit, which has permission to screen at public screenings. It has a lot of promotional materials and a study guide.
Yeah. The other thing I want to say, apart from the self-interest that we have about that, is, and this is happening all over the country, which is really positive, is that we are electing Congress people that are for single payer, that are willing to really take a stand and for single payer. So voting in the right people is really important. that's not only on, and along with that, voting in the right people locally, in your communities, in your states,
Your city council.
your city, well, whatever, yeah. The primary reason, along with big money, that we're in kind of the situation we're in right now with all the red state congresses, is that they have done this gerrymandering in most of the states. So being able to get people elected that can change that gerrymandering in those red states is really important.
I'd add to that it's really important to go to where small business owners are, because they're one of the ones that will benefit the most, but they tend to be more in the Republican leaning.
Yeah.
But they may not know how much this could help them. So chambers of commerce in smaller towns and areas, if they can see the movie, it might be really helpful.
Yeah.
And write your legislators.
Yes.
Right, yeah.
Legislators, yeah.
Yeah.
Yes.
And,
in Canada, the businesses have nothing to do with providing medical care for their employees, and so it's much easier for small businesses. They don't have to pay any kind of healthcare premiums for their employees at all. It's a big barrier here.
Well, that's Lucy. There's no one else who has their hand raised. So,
Well, we've come to the end of our time, and we are so appreciative of your giving the presentation and answering questions. It's inspiring, and hopefully it will get all of us to work harder on it. It's really important, and
don't
the work hard is really necessary.
Yeah, we're getting
people. Go ahead.
Yeah,
we're getting closer. We're very
yeah, definitely. And so I do recommend that you check out their website and get the movie. It's really excellent, and you'll enjoy it. Also, UUJC and UUSJ are doing a series of webinars, and we hope that you'll join us. They're monthly approximately, and Chuck Collins is the next one. So if you go to the UUJEC website, uujec.com, you will learn about the next ones that are coming up, as well as there being emails to that effect.
Yep.
So
Next one's October 5th.
October 5th, right. Same time. And we're just thankful for all of you coming on. I hope that you'll work hard, and also keep us informed of what works, because we want to spread that word. So let us know at UUJC what really has worked in your congregations and your towns, and we'll try and get more and more people involved. So thank you all.
You can also, on our website, you can subscribe to our newsletter, which we have been coming out once a month, and it has some of that information in as well that people are doing.
Great. Excellent.
Okay.
Thank you.
Thank you, everybody.
Thank you. Thank you, Terry and Laurie. Thank you, Lucy.
Good. Thank you, Michael.
Good evening.
Bye-bye.
Bye-bye.